We're at the end of Men's Health Week, and it's one more chance to make males aware of preventable conditions. Research shows that men are less likely to seek medical help, especially for mental health issues. But why is that? Let's explore some more this very vast issue with our resident GP, Dr. Donny Fick, who's with us in the studio. I was going to start today by asking you, how often do you get, if you go to a social setting, you know, I've got a bit of a scratchy throat, because I woke up this morning and I was like, oh, I've got a bit of a scratchy throat. Maybe I can ask Donny when I see him. Do you get that as a lot as a GP?
Time. It's like an opening question. I used to work in plastic surgery for a while, and the question
and then
was
it's like, I've got this mole on my back at this
like,
party. Will you have a look?
My breasts, do you think they need to be bigger or larger? So the questions have gotten better since I've...
Wow. And have you learned to navigate it a little bit smoother?
Yes, definitely.
Okay. All right. Well,
you need a little bit of tactical nous just to...
Well, if the scratchy throat becomes worse, I shall make an appointment, because that's the professional thing to do. Dr. Fick, thank you so much for joining us this morning. Men's Health Week, it's only 1 week, and I feel like it should be far more, because, like you said, the statistics involving men's health, specifically in this country, is quite vast. And let's try and split up the conversation so we can get through as much as possible. I'm at that age now, I won't say you, but I'm at that age now where you have people over, you're sitting on the stoop, and invariably you have the types of conversations now that you never would have had, say, 10 years ago. For instance, you'll ask a male friend, but when last, you're feeling a certain way, but when last did you go and have your prostate checked? Or maybe you shouldn't be drinking another glass of red wine because it's not good for gout.
Yes.
From a physical health point of view, what are some of the biggest issues for South African men at the moment? I'm assuming a lot of it has got to do with lifestyle.
Lots of it has got to do with lifestyle. I think we have a country with bad lifestyle choices. Smoking still ranks up very high. And vaping, people go, I've stopped smoking, I now vape. It's equally as bad. So smoking, vaping, lack of exercise, being overweight and obese, bad diet, and how we binge with alcohol is also a huge problem.
Well, let's talk about the big C specifically, because we spent a lot of time also speaking about how early diagnosis when it comes to cancers, particularly focused on women, is all important. I'm assuming the same pertains to men.
Yeah. So I read an interesting fact yesterday that the average age of diagnosis of cancer in women in South Africa is 59. It's 64 in men.
Sure.
The average death age of cancer in women is 63, but it's also 64 in men. So men get diagnosed and die very quickly of cancer. So we often find their cancers at a very terminal stage. If I look at the top 4 cancers in men, prostate cancer, lung cancer, colorectal cancer,
sure,
or non-melanoma skin cancer, all of those have a screening test that can be done. All of those don't need to be diagnosed that late on, whether it's a blood test for your prostate, whether it's a colonoscopy for your colon, whether it's just going to your GP or your dermatologist to look at moles that are a bit suspicious. Those things can be screened and maybe caught early and maybe even prevented.
When are the right times then to seek help? We know that at a certain age, men need to start going for a once-a-year checkup on the prostate. When is the right time to go and have something looked at or checked specifically?
Today.
Okay.
I like to tell my patients that from the age of 30, I think you need to start being aware of some of these things. It also depends on what your family history is. I think if you've got a family history of cancers, diabetes, hypertension, go and check those things early. Like, there's no time like now. Obviously, we also appreciate the difficulty to access healthcare in this country, which I think is a conversation for another day. But if you have the opportunity, please just go and get a general checkup done.
What about gut health? One would think that that is specifically connected to lifestyle. We love our meat in South Africa. We particularly love our booze as well. Women are always being told gut health. All of your health is here in your gut. But South African men specifically, I know we brag about the dad bod, but some of it should be seen as a red flag, shouldn't it?
No, exactly. Central obesity, and I think we're all guilty, myself as well. That's why it can't be called Men's Health Week. That is also a bad prognostic sign for cardiovascular disease. So if you've got a bit of a dad bod, your risk of a heart attack or a stroke much later on becomes much higher. And those are things that can be checked as well. Go for your blood pressure, check your sugar and your cholesterol.
Now, let's speak a bit about those lifestyle habits. We know that during lockdown, when we had those booze bans that really had everybody up in arms, people really started asking the question, interrogating the question about whether South Africa has a drinking problem. What are some of the numbers you came across with regards to our drinking habits, particularly of men in South Africa?
So 41% of men in this country drink. 17% of them partake in hazardous drinking. That's binge drinking, that's drunken driving and all the negative things that go with that. The guidelines say that if you're drinking more than 2 drinks a day, you're drinking too much.
Sure.
I mean, that's a double whiskey done, right? And that's your allotment for the day. So we drink a lot more than that in this country.
And a lot of it gets glorified. I mean, we've got I know in Cape Town, you'd have a big party day on a Wednesday. It's Klein Saterdag, as they call it down there. And I think over here we've got Thursdays.
Yeah.
We do glorify it as part of our lifestyle in leading up to the weekend. And those are really unhealthy habits, isn't it?
Very unhealthy habits. And that all ties in with, like, obviously there's the whole gender-based violence, trauma that goes with alcohol.
Absolutely.
But also just if you think about how it affects your health. Increases weight, increases your risk of diabetes because alcohol's got a lot of sugar in, increases your risk of cardiovascular disease. It's just generally not good for you and shouldn't be glorified the way that we do it.
And so much of what we've spoken about already today in terms of our physical health and our lifestyle habits, a lot of that also feeds into the big one, which is our mental health. And I read that from a percentage point of view, men in South Africa, or indeed it's prevalent around the world, men are far less likely to seek help for mental health issues than women are. What are some of the experiences you've come across that, and what are the numbers saying?
Definitely. And I think men, we need to break down the social stigma that talking about your problems is not a masculine thing to do. I think we need to break that down and be like, look, we are in big trouble as men in this country. And I think there's a whole socio-political aspect to that we can't get into today. But if you just look at the numbers, I think South Africa ranks in the top 10 most prevalent suicide rates in the world.
Wow.
Which is crazy.
That's mind-blowing.
24 out of 100,000 people in this country kill themselves, which breaks it down to 3,000 people per day commit suicide in this country, which men are 4 times more likely to do it than women are. So we've got a big problem. We don't talk about it until we get to such a point that we end up committing suicide. And that is the biggest alarm bell out of all of them.
And that should be something that's alarming, just not just for men, but for all the communities and the families that they come from, because people are not silos. They're not going through life on their own. Where do you think we should start?
At a primary school level. I think as young as possible, when young men get taught that it's okay to talk about your problems, it's okay to have a bad day, it's okay to be vulnerable, and I think that's a very important word. But I think also men generally in this country carry a lot of responsibility, like supporting families, supporting communities, and just getting to a point where you're like, it can get a little bit heavy and overwhelming.
And during these tough economic times, the cost of living crisis is everywhere. Men specifically are feeling the pinch, aren't they?
And I see a lot of men in my practice, and I've seen this since COVID, where lots of men have become retrenched and then they've now become dependent on their wives. And there's been a huge dynamic shift, and they struggle with that. They struggle with the fact that they've now become dependent on their wives. They've lost their masculinity. And that's also okay. Like, we need to break down those typical roles and just be there for each other.
In your practice as a GP, how does mental health issues of whatever kind, and there's a vast array of them, what are some of the physical ways that mental health issues can manifest itself and that then comes to present themselves in your practice?
So when I was looking at the top 5 causes of death in South Africa, not managing chronic stress is number 5.
Wow.
So chronic stress obviously pushes up your blood pressure, and the more stressed you are, the less you sleep, the more you drink, the more you smoke, the less you exercise. And all of those things have a negative effect on your cardiovascular health, which is still the leading natural cause of death in this country, ischemic heart disease and related consequences.
So all of that can lead to the things that we spoke about in the first part of our conversation.
Exactly. They all feed into each other.
So it's gut health, it's diabetes, it's heart pressure. All of those things can manifest itself physically as a result of mental health issues.
Exactly, because your brain and your body are attached. They're not 2 separate organisms. So if you're not looking after your mental health, your physical health deteriorates. I think also if you don't look after your physical health, your mental health deteriorates as well. There's definitely a symbiotic relationship between the two.
And just one final question before we let you go today. When you are having to deal with that in the office, because people come to you and say, oh, you're a GP, I'm coming to you because my tummy is sore, or please check my blood pressure, blah, blah, blah. Does it become difficult to then broach the subject to say, okay, yeah, these are the things that are presenting itself physically, but I think we need to have a bigger conversation here?
I love that part of, like, we'll sit down after the examination and I'll be like, are you stressed? And the first thing is like, no, I'm not. And then there's a pause and we're like, let's unpack this a little bit more. Like, it's not most probably you losing your job or you're losing your life right now, but there's so much subconscious stress in this country that's eking away at men particularly.
Are you seeing an increase in that in your practice?
Oh, definitely. Definitely. It's become much worse post-COVID.
Should we be aware that this is perhaps a sort of a sleeping crisis that we need to be paying attention to?
Yeah. I mean, if you just look at the statistics, the suicide risk, putting us in the top 10 in the world is definitely a big red flag that South Africa's in big trouble. We've got lots of other socio-political issues, but I think if we don't take care of our health, who's going to end up doing the jobs? Who's going to look after families? Who's going to raise children? These are all big crises that could be looming in the future.
So let's leave people with some tips and some help,
Yes.
because it could be a very depressing conversation on a Sunday, on a Sunday morning, on Father's Day specifically. A family could be watching right now, or a couple could be watching right now, or some guys could be watching us right now, and they think a friend or a father or a loved one perhaps needs to go and see somebody, if not for mental health issues, but for physical health issues. What are some of the signs they should look out for, and a way of broaching it to encourage them to at least go and seek help from a professional?
I think it's just breaking the ice and just going to just make an appointment with your general practitioner if you have those means, or if not, just go down to your local clinic and just go and say, look, I'm here for a general checkup. I just want to check my blood pressure, sugar, cholesterol. That's a good way to enter the system, and then the doctor can take it from there and see what else that you need.
And that's a deep breath moment, a deep exhale moment. Put yourself in the hands of a professional, and you just take it step by step from there.
Exactly.
Thank you so much, Dr. Donny Fick, our resident GP. Some good advice. Perhaps don't reach for that second kusister with your coffee this morning if you are indulging, and perhaps go and see somebody later on in the week to make sure that you're just ticking all your boxes, crossing all your T's, and taking care of yourself and your family in the best possible way.